And welcome back to SIROWORLD 2016. We have yet another lively bunch of fellas here. A lot of doctors, a lot of energy up here.
A lot of energy.
Hello, Dr. J. Reznick at the end.
Good afternoon, David.
Dr. Tarun, we call him Mr. T, Double T, T-Steak.
T-bone.
T-bone.
That's a good one.
Anything.
It's a fine piece of steak, I'm just telling you.
Dr. Scott Pope and Dr. Doug Schulz. Anyway, today I couldn't wait for this one about cone beam technology, so let's just dive right in. Who wants to start?
Let's let Scott
What do you
start.
want to know?
Okay.
Yeah,
Where do you want to start? I mean, honestly, I got into cone beam specifically for implants to begin with.
Okay.
But in all honesty, after utilizing cone beam for probably about the first 2 weeks, I realized there's so much more value in that cone beam image. And what we're doing now with cone beam is so much different than what I initially intended it to be. We're doing sleep apnea with it. We're doing implants. We're doing guided, implant placement, sinus lifts. It gives us so much information to see. It's such a great benefit for the patients.
Yeah, when you can see the patients in 3D, it changes the whole game. I'm an oral surgeon, and so I used to use a panoramic for evaluating wisdom teeth, impacted canines, pathology, and sometimes I get in there, and where I thought that tooth was positioned, I thought it was maybe rotated this way, it was actually rotated that way, and had I known that, it would have changed my whole strategy of how I would have done the procedure. When it comes to evaluating wisdom teeth proximity to the nerve, it used to be we'd follow some rules of thumb that you learned in residency on the panoramic, and 80% of the time it was accurate. 20% of the time you get in there and you want to, well, I can't say that, what you do in your pants when you get the tooth out, but having that information ahead of time makes the procedure so much more relaxing.
Yeah.
And efficient because you know exactly what you're getting into. You're not pussyfooting around, gently removing the bone just a micron at a time. You can actually, where the nerve is located in relationship to the root or the pathology. You just get in there, you do what you need to do with confidence that no other imaging modality can give to you.
You have so much material there that T-Bone wants to jump on right now, so I'm going to... What's the biggest benefit for you?
Well, I have a totally different story on cone beam. Scott's right, Doug's right, Jay's right. I look at cone beam totally differently. I look at what it's done for my practice as a whole, what it's done for me personally and for my family. And really what it's done for me is it's allowed me to get rid of things. And it's allowed me to get rid of fillings so that I can focus my efforts on those things that give me more satisfaction. Allowed me to focus on those things that are more productive and profitable for me so that my practice can still do those things. I can bring in an associate who can do crowns and fillings and do many of those general dentist procedures, and I can focus on more of the specialty work. I can take more time off. I can do those things that allow me to want to continue to grow and allow me to want to continue to really be engaged in dentistry. So I think for those of us that are in that place in dentistry where we want more engagement in our practice, we want more vibrancy in our practice, and we want more satisfaction. We want to love going to work. Cone beam will bring that to you. It brings all these other things, no question. And that's the starting point.
It's
right?
that one piece of technology that can actually just transform your practice to a whole different level of treatment.
It energizes you because it brings in procedures and techniques that you never dreamed you could do before. And now all of a sudden, you have all these capabilities. And the technology is pretty cool. And even if you've been in practice 20 years or so, some people start getting burned out. But as you incorporate cone beam and CAD/CAM technology into your practice, it changes the whole game, and suddenly you're excited about practicing again.
Well, Doug, you better jump in here.
Speaking of 20 years and gray hair.
I am, so let's talk.
20 years and gray hair, there we go.
Yeah, so let's talk about the experience for the patient, because really that's where it's focused for me. It's when you take that new patient and you show them 3D, and they own their problems. It's not like, what the heck am I seeing on a 2D pan or a periapical? Yeah. When they see it in 3D, they know.
Yeah, they sometimes point it out before you point it out to them.
But the beauty is you can take that scan and within 5 minutes be having that discussion with the patient.
Oh,
it's not something where you got to call them back and reappoint them for another day to go through the image. Yeah. It's up, it's fast, it's easy to view, easy to manage. My staff can do it. I love it.
Yeah. So it does change the economics. So,
Yeah.
you know, from the day, T, you're my hero, you're my leader. You know, I followed a lot what you've done, but, you know, the impact economically on your practice, when you integrate cone beams. CEREC is good, but you're trading lab dollars. But when you put 3D in, it just explodes what you do.
Yeah, not only that, but when we talk about doing implants, it makes the whole process so efficient. I mean, I used to schedule for let's say I'm doing 6 implants on a patient. That used to be a 2-hour appointment. Now we can do that same case in under an hour with an incredible accuracy and precision, and the patient really does better as a result because it's a less invasive procedure, it's quicker, and they got a perfect result.
Jay, my first guided implant was 12 minutes from the time I numbed him to the time I was putting him up in the chair.
It wasn't.
What took
You're
you
lying.
so
You're
long?
lying, Doug, because I know you made it take longer, so the patient didn't ask why it cost so much.
And then I'm sitting there thinking, okay, I need to talk to this patient for at least another 20 minutes to make it worthwhile.
Exactly.
See, that's the benefit of having my patients asleep.
Oh,
The exciting thing is it takes you to a whole new level of dentistry.
Yeah.
I mean, I'm doing things now that, in all honesty, if I didn't have that cone beam, I never would have dreamed of doing. I mean, sinus lifts, you know, treating sleep apnea, being able to see things that I could never see before.
Yeah, and you know, and the integration of CEREC and Galileo's is another thing that's really changed the picture in my practice. I went through 8 years of medical school and surgical residency so that I would never have to do another restoration again. And I've come full circle. I have my Omnicam and my in-lab MCXL, and I'm milling provisional restorations, sometimes even final abutments for my referrals, and I love it. I never thought I'd be doing this.
There was such a crescendo of excitement there for a second.
Oh, sorry, we'll have to tone it down a little bit.
And actually, Dr. Pope, I was going to ask you about how your patients feel about the investment that you've made, because you made a comment that made me, it was the way that you were interacting with your patients. How do they feel about this investment?
It's eye-opening for the patients.
Yeah.
It brings a lot of confidence of my patients in me, if I'm saying it the right way. I think my patients, you know, value what I have to say. They believe, you know, when I show them right there on the image, you know, what needs to be done, what can be done. They would much, in all honesty, if you ask your patients, would you rather be referred out to another doctor or have the dentist that you see all the time take care of everything for you? They would rather have the dentist that they know and trust take care of their dental care.
And that's why they're in your practice, right?
Sure.
Because
Exactly.
they for some reason they trust me, right? and you know what you're ultimately saying is there's a perception, right?
There
so
is.
if you walk up to somebody and you got a flip phone, they think of you as one way, but if you walk up to somebody and you got a smartphone, they think of you another way.
Yeah.
So if you're walking up to somebody and you got an X-ray like this, and you're walking up to somebody with a 3D X-ray, whether you know what you're doing, it doesn't matter. Whether the patient really understands it doesn't really matter. They just get that feeling that they're in the right place.
Well, it's the perception, right?
Yeah,
Right,
it's absolutely all perception.
I also know what things I can do in-house.
Yes, the
and
comfort.
what things that I'm comfortable with, and
It's
what things I need to
it's
refer
comfort.
out.
Because you have all the information up front.
Exactly.
It does. It's comfortable. You know, you talked about the pucker factor, because I know what I can do, and I know when I need an oral surgeon to do the surgery with me. And T, your presentation's spot on.
Thank
as far
you.
as you need to find a specialist to work with, and you need to bring them into what you're doing.
Yeah, that's so critical that you work together.
You know, I was just thinking about something. I'm sorry, David, if you don't
No
mind.
worries.
And I think this is to me the ultimate beauty of this technology. We have 4 dentists here. You know, we have a specialist, 3 general dentists. We have West Coast, East Coast, Midwest. Different areas of the country, different types of practices, and the technology works everywhere.
Yeah.
I mean, it's not like this technology only works in fee-for-service. It only works in insurance. Only works on the West Coast. Only works on the right coast. Even works over flyover country, right? I mean, the technology just works everywhere.
Yeah.
And that's really the beauty of it, not just for specialists. And this technology used to be just for specialists.
Right.
But this technology is really for everybody. And to me, that's really what I want. I want more people to get into the technology so they can see the benefits. They can see that initially, maybe it's one procedure they want to get into. And then they can see it's more than one thing. And then they can see, you know what? Why am I doing fillings?
Well, it ultimately comes down to better care for our patients.
Yeah.
Better, more comprehensive care.
And that's the bottom line.
Yeah.
And speaking of bottom line, we got a bulb because, as you can see, was I right? Animated, fun, but We got a lot to talk about. We could probably talk about this all day long. Guys, thank you so much.
Thank you, David.
Always
David,
fun.
thank you.
You're welcome.
Always
Thank you.
fun, educational.
Yeah.
Let's take a short break. Back with more Zero World 2016 right after this.